Today we'll talk about safe and painless testosterone injection protocols. Quick disclaimer, this is not medical advice, this is entertainment only. So congratulations, you went to your physician, you got your testosterone levels checked, you had low testosterone symptoms, your levels were low. Next step, you get prescribed testosterone, you get your testosterone vials, you get your syringes, you get your needles, you get your alcohol swabs. Perfect. You have everything at home. Now what's next? How do you inject that? So injections are scary, especially when you're new to this. And if you do it the wrong way, especially at the beginning, you can really hurt yourself in the sense that it will be painful, or it could be painful, and you can also build a serious amount of scar tissue. So in this video, I will try to show you how to avoid pain and scar tissue buildup during those injections. All right, so you'll most likely have your testosterone vial, which is an oil-based solution, most likely. So oil-based solution means that it is not in water, but in oil, so it will be harder to pull out of the vial and to push in to the muscle tissue. So therefore, we will have most likely a drawing needle and an injection needle. So the drawing needle will be most likely a 18 gauge needle. So 18 gauge. So remember that with needles, the lower the number, the thicker the diameter. Okay, the higher the number, the thinner the diameter. Okay, so 18 gauge is pretty thick. If you inject with an 18 gauge, it will be very, very painful and you will build a lot of scar tissue. So please never inject with an 18 gauge needle. These 18 gauge needles usually come in a pink package and they are only there to draw the medication from the vial into the syringe. All right. The syringe is probably going to be a 3 ml syringe. Everything else would be probably too big in the context of testosterone replacement therapy. In testosterone replacement therapy, it is usually 0.5 to 1 ml per injection, depending on the dosage of the medication. But let's go with that. Let's assume you inject 1 ml per week. You have your 3 ml syringe, you have your 18 gauge needle. Now you need an injection needle. The injection needle is basically the needle which will inject right into the muscle tissue. And this is usually a 25 gauge needle. First question that comes to mind, can I draw with the 25 and inject with the 25? You probably could, but what happens once you poke the rubber top of the vial with the 25 gauge needle, the tip of the needle, which is sharp at the beginning, will become very dull. And nobody wants to inject with a dull needle. Okay, it will be much more painful. So don't try to draw with a 25 gauge needle. It will first dull the tip of the needle, and second, it will take a lot of time because this needle diameter is very small. So just screw or push your 18 gauge needle onto the syringe, depending on the make of the syringe and the needle. Sometimes you have to screw, sometimes you just can push it on it. It depends. Make sure you understand which syringe and needles you have. So you have your 18 gauge on your 3 ml syringe. Now take the cap off, the security cap, the plastic cap of the vial off. Always wash your hands before doing any of this. And then get your alcohol swab and you can swab down the rubber top of the vial. Now you have your 18 gauge syringe, 18 gauge needle on the 3 ml syringe. Now next thing you want to do is you pull the plunger and you draw some air into the syringe until you get 1 ml of air. So 1 ml of air is the same amount of solution you want to draw into the syringe. So you take the needle and you poke it into the vial, into the rubber top, right in the middle. Make sure you don't hit the sides. Then you inject the 1 ml of air inside of the vial, turn it upside down, and now you pull the plunger until you get 1 ml of solution into the syringe. So injecting the same amount of air into the syringe, into the vial, will allow you to build some pressure inside of the vial and make it so much easier to draw the solution out into the syringe. But if it's an 18 gauge needle, it shouldn't be hard to draw that solution, even without that step of injecting the 1 ml of air. You can just also stick it in and draw the 1 ml of solution. Now you have the 1 ml of solution. Recap the needle, very important, and make sure you draw the plunger down so that there's no solution remaining in the needle. You can go a little lower than, so you see a little bit of space in between the solution and the beginning of the needle. Now you have your needle, 18 gauge needle capped. You screw it off or you take it off depending on the needle, and now you want to put on the 25 gauge needle. So you pull it out of the package without touching the extremity where you stick it on or screw it on the syringe. Keep that area clean and screw it or put it on the 3 ml syringe with the solution in. Once you have that, make sure there's no air bubbles. If you have some air bubble on the bottom, you can do this to the syringe a couple of times until you see the air bubbles coming to the top. Once you see the air bubbles at the top, you can slowly push the plunger up and have the air coming out of the tip of the needle. Now sanitize your injection site. I would always recommend the buttocks, the butt. Why? It is very, the pain is very minimal in this area, and there's very few nerves you can hit if you choose the right location. So if I draw a representation of the butt cheek, left, right, so I would always suggest to inject in the upper outer part of the butt cheek. These areas in red are dense with nervous tissue, so I would avoid them. Always on the upper outer quadrant of your left or right butt cheek. So now you sanitize this area. Let's say you are planning on injecting this area. You sanitize this area with the alcohol swab. Let it dry, maybe 30 seconds to a minute. If you inject right away when the alcohol is still there, it might be a little more painful, so maybe wait 30 seconds to a minute. Then take your syringe, and at the beginning it's going to be a little hard. Sometimes you have to twist to reach there, but it will get easier with practice because it's on the outer side of the buttocks. Stick the needle all the way in. I would recommend taking, if it's a 25 gauge needle, maybe an inch needle. If you don't have too much subcutaneous fat, 1 inch should be sufficient to reach the muscle tissue. Remember, you want to go all the way into the muscle. You don't want to stop inside of the subcutaneous fat, to the fatty tissue under the skin. So you want to go all the way into the muscle. If you're someone who has more fatty tissue on the buttocks, maybe a longer needle would be better to reach all the way into the muscle tissue. Once you are all the way in with the needle, avoid jiggling around. Otherwise, this will cause also scar tissue buildup. And then gently, keeping your arm firm and stable, pull the plunger, push the plunger all the way in until the 1 ml are inside of the muscle tissue, and then carefully pull the syringe out. You might see some blood coming out. That's normal. When you pull out the needle, you might hit some blood vessels, and then apply gentle pressure with an alcohol swab until the bleeding stops, and then you should be good to go. And recap the use needle to avoid any accidents. And another thing, why would I always choose a 25 gauge needle for injection? It is because it is very thin, but it is wide enough to allow the oil to be pushed through very easy. So if you have a higher gauge needle, let's say a 30 gauge or 31 gauge needle, like insulin needles, you can inject oil-based solutions like testosterone and anthocyanate, but it will be very hard to push on the plunger. And sometimes this will make you shake with your hand, and the needle jiggles and shakes around, and this can also cause some tissue damage leading to scar tissue. If you choose a needle size that it is smaller than 25 gauge, let's say 22 or 23 gauge, then the diameter is bigger and it might be easier or faster to inject, but each injection hole will be thicker and you damage more muscle tissue and you build up more scar tissue. So keep that in mind. In my opinion, 25 gauge is the sweet spot where you minimize pain and scar tissue buildup while keeping the smooth flow of injection of the oil for the testosterone medication. So that's it for safe and painless testosterone injection protocols. Again, this is not medical advice, it is just entertainment. Please let me know if you have any questions, comments down below. Thank you for watching and see you the next time.